Welcome to our next installment of Doc Talk. I'm Dr. Rich Briones, Chief Medical Officer at Good Samaritan Hospital. And today I have the distinct pleasure of having with me Dr. Fahd Khan, a member of our medical staff for a few years. I'm delighted to have him here with us today to talk a little bit about who he is and what he does.
Great. Thanks for having me, Dr. Briones. Great to be with you here today.
You and I, in particular, worked on a case many years ago with a patient that had a movement disorder. And I know that's what really is your expertise.
So that's not only my expertise, I would say it's also my passion. The case that we did together was the first deep brain stimulation surgery performed here at Good Samaritan Hospital, asleep.
And I know that patient has since gone back to visit you. I've seen some very striking video about that. And I know that can be and has been very life-changing, for that patient and certainly all the patients that you treat. We are also very excited that we have a new technology that is going to be coming to us at Good Sam that is going to help patients like that patient in a very, very significant way.
We are lucky and fortunate enough to be able to get this procedure. It is essentially incisionless brain surgery. So what that means is there's no opening of the scalp, no hole into the skull, and what it uses is ultrasound waves to penetrate into the skull and heat up a particular part of the brain that's essential for controlling different types of tremor.
Doesn't take very long from what I understand.
That's right. So it's an outpatient procedure and the results are instantaneous. So usually the patient would come in, the scan is done in the MRI scan and the procedure is performed in the MRI scan. So it's not necessarily in the operating room. Patients do not require any anesthesia. They come into the suite and they're fitted with a helmet, and through that helmet, they're fitted with a transducer of ultrasounds. And those transducers of ultrasounds are able to focus on a particular part of the brain. We're talking about millimeter accuracy. And what that does is all those transducers focus on that particular part. They heat up that particular part of the brain, and then the surgeon comes in and out of the MRI suite to see what their responses are.
These effects are striking because as some of us know that have relatives that have these type of things in their lives, they can be very, very debilitating. So to be able to come in and essentially not be able to lift a cup of water up to their lips, because they're shaking as much as they are, to within an hour be completely transformed, the emotions that take over both from the patient and their families is truly amazing. I think our patients, our medical staff, our community are very, very fortunate to have someone here, locally that has the expertise that you have, coupled with the technology that's forthcoming, what we're going to be able to offer to our patients, and certainly, continue your passion, in the space is outstanding. So I want to thank you for your time to visit with us today.
Great, thanks. And I'm really looking forward to partnering with Good Samaritan Hospital. I really think this is an asset to the community and will continue to bring the cutting edge care that people deserve here.
Wonderful. Great. Thanks, everyone.